to Health Literacy Out Loud. I'm Helen Osborne, President of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this podcast series, Health Literacy Out Loud. Today, I'm talking with Cliff Coleman, who is a physician and international expert in the field of health literacy. His award-winning work focuses on improving health literacy and clear communication training for healthcare professionals through the systems approaches, including curriculum design and evaluation. Cliff is professor of family medicine at the Oregon Health and Science University, or OHSU, School of Medicine, and he serves as clinical thread director for education on health communication, professionalism, and ethics. Cliff also is the chair in compassionate communication at OHSU's Center for Ethics in Healthcare. In addition, Cliff chairs the OHSU Health Literacy Workgroup, which aims to help the university OHSU become a health literate organization. Cliff and I are longtime health literacy colleagues and advocates. I am delighted that he agreed to again be a guest on Health Literacy Out Loud, this time focusing on the importance of health information equity. Cliff, welcome to Health Literacy Out Loud.
Thanks, Helen. It's so good to be with you.
Oh, it's wonderful that we're doing this again. Last time we did a podcast together, it was on telehealth. So it's all variations of health communication, and you always seem to be at the leading edge of whatever the topic is. Now it's all about health information equity. Please explain to me and everyone, what do you mean by that term?
Yes. Well, first, Helen, let me just congratulate you and tell you thank you for 25 years of Health Literacy Month.
Oh, thanks for acknowledging that, Cliff.
It's really a tremendous contribution to the field, and it's a great privilege and honor for me to get to be here with you celebrating, so thank you for that.
And you have the spot of honor. October always is the spot of honor when it comes to these podcasts. So we're a mutual admiration society, and we've both been doing this for a long time.
That's right.
But the focus now is on health information equity. That's a term I'm just hearing little stirrings about, or some variation of that. I'd like to know more, and I assume many of our listeners would too. Explain it, please.
Sure. I view health information equity occurs when health information is made accessible and understandable to everyone. And in many ways, that's the other side of the coin to health literacy, isn't it? Health literacy being a person's ability to find, understand, and use health information. Mm-hmm. Health information equity is really us in the healthcare sphere making that information accessible and understandable and for all. And sometimes we're good at it for some, but not for everyone.
Well, tell us more about that.
Well, for years, the field of health literacy, I think, really tried to identify ourselves as working in information technologies that helped everyone. We see health literacy as affecting everybody, don't we?
Right.
Healthcare professionals included. And for many years, we worked to really make sure that we had that very inclusive viewpoint, that we were thinking about health literacy for everyone. To do that, we really consciously decided to not focus on subgroups or subpopulations for whom health literacy is perhaps even more important or more of a community issue. And so in the United States, where we have an education system that's largely funded through tax dollars and tax structures, right? We have a lot of inequities in our education system, and those trickle down into social determinants, right? So when we look at the population as a whole, we can see that certain populations are not exposed to the same quality of education as others, right? And those tend to be certain racial and ethnic minority groups, Black and African Americans, American Indian, Alaska Native, Hispanic, Latinos particularly, for whom education system's not holding up its end of the bargain.
Thanks, Cliff. And on this, I've been there almost from the start of health literacy, and as you have, we've been doing this for decades. I remember when it was very inclusive. And I talk about reasons people struggle to understand. And I talk about many reasons there, particularly 6 of them. I talk particularly about issues of literacy, age, language, culture, disability, and emotion. You, sounds like, are focusing specifically on education, which is not one of the groups that I put in there when I tell these stories about it. So that's an interesting spin on that. And then it sounds like you're taking it from there about who that most affects, the issues of education, not just, other factors too in there. How did you get to this point?
If we look at those groups who are really not experiencing equity in education, they're the same groups who grow up to be adults that have lower health literacy.
Okay.
When we look at the national data from the National Assessment of Adult Literacy, for example, we see that those very same groups that I mentioned earlier are those that experience lower average health literacy, at least at baseline. So the important thing that we've not spent as much time talking about in this field is that when we as a system are not producing health information that's easy for everybody to understand, we are systematically excluding people from access to information that's usable and understandable. And those groups tend to be racial ethnic minority groups. And by virtue of not producing information that's more universally understandable, we're creating systemic inequities for those communities.
Okay, I've got a few different directions I want to go with this, but I'm a real fan of stories. And you're a practicing physician, perhaps having less of a clinical practice and doing more administrative and other brilliant things in your life. But tell us a story about how, in your practice or your experience, this really made a difference.
I have the privilege of working at a clinic that's a federally qualified health center here in Portland, Oregon. So my patients are essentially 100% low income, often mostly receiving Medicaid or Medicare services. And that community has a much lower average education and opportunities in many other aspects of life as well. In that environment, you can very easily see the impacts of educational inequities and how they play out in terms of lower health literacy across the whole clinic population. And for us, it's pretty easy to recognize the need for our clinic to emphasize health information equity and to work toward that. Now, I also work at our university hospital, where there's a different mix of patients. In that side of my practice, I can see where we as an institution don't really recognize those health information needs for the population that we care for. And so I'm really concerned about that we're not, as a system, providing that real equitable focus on easy to understand, usable information.
Thanks. I'm going to ask you to define a few more terms for me as I'm on my learning curve for this. You use equity. I've heard the term equality. You used equitable. And you've also used terms such as disparities and inequities. Can you make sense of this for me? Do what you're saying to do for others. Explain it to me in ways I can truly understand and take action on, please. A rafter of similar words.
I love it. We talk so much about jargon, and then here we go, right?
I know you well enough to call you on it. Okay.
Let me key in on a couple of those terms. So let's talk about inequities and disparities. In healthcare, inequities are differences in the way healthcare is delivered. And so right now we're talking about health information inequities, the way health information is presented differently to different groups, let's say, or differences in accessibility or usability for different groups.
Okay.
And the impact that has on populations is what we call disparities. So differences in care lead to differences in outcomes. So when we talk about equity in providing equity or delivering information equitably, right? We're talking about finding ways to create health information messaging, the way we speak to people, the way we write for people, making that equally accessible across populations.
Thank you. And then the other term is equality. And I've seen some images about, people looking over a fence or riding a bicycle or something, kind of differentiating between equity and equality. Could you give a verbal description for us, please?
Well, equality is doesn't quite achieve what we need in healthcare. Equality is essentially putting an opportunity in front of people and saying that it's up to them to essentially use it, let's say. The problem with equality is that there are so many systemic barriers for folks in this country and elsewhere, that you may put an opportunity in front of a person, but they may have other barriers that prevent them from using that opportunity.
Oh, okay.
So equality doesn't quite get us there. Equity is taking it a step further and saying, the opportunities are there and the barriers to using those opportunities have been lowered.
So is the equity really on us as communicators?
That's exactly how I see it. I think that we have this rich diversity in this country and so many different experiences, degrees of education, degrees of health literacy specifically. It's up to us as healthcare professionals working in the field to lower those barriers to understanding, those barriers to accessibility, to useful information. If we don't do it, we can't expect individuals and communities to be able to take full advantage of health information that they need to achieve their health goals.
Okay. Well, I want to just focus a little bit more and soon get into strategies like, okay, we've got a problem. What are we going to do? But first, you've talked about issues in the United States. Our listeners could be anywhere in the world. Is this a U.S. only issue?
A lot of the hard data on this comes out of the United States, although we're seeing more and more of it coming from Europe and other countries as well. But I don't think it's unique to us here. We certainly have a somewhat unique healthcare system that creates particular challenges and difficulties. And I can't speak to how other countries, other systems may or may not work better. But I do think that the way that healthcare professionals are trained globally is similar enough that I think it's fair to say that healthcare professionals anywhere are likely not trained well in providing equitable access to easy to understand information.
Thank you. That leads into my other question for clarification. You talk about health professionals. For listeners of Health Literacy Out Loud, and you and I know many folks doing this health literacy work, we're not all clinicians. So we're not all in a medical setting. There might be many people who are in public health or community agencies or communication companies or somehow helping to get the message across. Does this health information equity apply to all of us, or is it strictly in that medical model?
No, it absolutely applies to everyone. Anybody who's interacting with individuals, the public, communities, families, caregivers, whether that's through spoken communication, whether that's through written communication, whether that's through public health messaging, it really we all need to own this and work on it as a system. Because, I think we've seen in many aspects of healthcare, if one group is working on something and others aren't on board, how far can we get? If just the clinicians are working on learning to be clearer communicators, but the staff, the nurse, the staff who answer the phones haven't done that as well, we're going to still have problems, aren't we?
We are. We're all in it together.
We're all in it together.
We're all in it together as far as the problems and the solutions. And I'm glad you're on the leading edge of this one. Cliff, probably now's a good time to mention an article that you recently published that was in JAMA, the Journal of the American Medical Association, that I think makes your point quite clear. And we'll have a link on your Health Literacy Out Loud webpage, but just want to use it as reference. You and several others wrote this article, Health Literacy and Systemic Racism, using clear communication to reduce healthcare inequities.
Yeah, that was a great privilege to get to work on that with two of my colleagues. We wanted to change the conversation. We wanted to put out a viewpoint that would kind of stir up the conversation a bit, both in the fields of health literacy and in the fields of culturally responsive care and health equity. And so we thought that the conversation in all these areas had kind of stalled out in some ways. We knew that we've been talking about health literacy now for well over 20 years. We've been talking about health equity and disparities for well over 40 years. And both of these fields have certainly seen progress, and that should be applauded and celebrated. But that progress has been slow, hasn't it? And we thought there was an opportunity here for us to kind of kickstart some new ways of thinking and looking at some of these issues that many people are very concerned about and spending lots of time thinking about. So we wanted to be able to help the folks who are looking at issues around equity and disparities and give a new kind of a reframe the issue there by saying a focus in on clear communication and doing that across in a fairly universal way where we're providing clear, easy to understand information for everybody is a really promising way to impact those inequities and disparities work. And we thought for the folks who are working in the field of health literacy that this is a way to gain entrance or a new way of looking at some of the issues that we are all working on here and get broader buy-in to the clear communication work that so many of us are doing.
It's interesting how you're bringing these different fields coming together on a common interest. So tell us about some solutions. It's not just problems. This podcast often focuses on, okay, I got it. What can we do? From your perspective, I'm curious, what can everyday communicators do? What can policymakers do? What can systems do? Researchers, where would you like this to go? And what kind of action would you like?
So in the paper, we argue that this solution that holds the most promise is the universal precautions for clear health communication approach that the Agency for Healthcare Research and Quality and others have promoted.
And we'll have a link to that on your web page too, on your Health Literacy Out Loud webpage.
Yeah, and that model being, the notion of creating informational messaging in its clearest, easiest to understand form as the sort of default position, as the first line of communication, rather than kind of the current status, which is either ignoring the needs for clear communication or not recognizing them, or some healthcare professionals trying to modulate or adjust the complexity of their communication based on what they think they know about the person they're speaking to or the community that they're working with, which doesn't work and promotes inequities. It leads to things like racial profiling, leads to stereotyping and other problems that support the status quo. So this notion of a universal precautions approach really holds the greatest promise. And it seems very simple on the surface to say, well, why don't we all just do that? Of course, being able to achieve a universal precautions approach is a big hill to climb.
So for those of us and listeners too who may not be thinking about this universal precautions in health literacy or clear communications every day, please give us some examples of things we can be doing. So when people are done listening to the podcast, they can go, I got it. I'll try that now. Right.
So that's great because universal precautions applies to the individual healthcare professional. It applies to the organization that individual may work within, and it applies to the bigger systems that organization and individuals are working under. And so we can think about it at all those different levels. But some concrete examples of things that all three of those levels can be focusing on. Number one is the use of plain language, right? Or in other words, the avoidance of what I would call unnecessary jargon.
Okay.
And when I say unnecessary jargon, I'm talking about, the 90% or more of jargon language that gets used with patients that doesn't help them actually understand or be able to use the information. The stuff that just gets in the way, the stuff that's confusing, the stuff that's distracting. So learning to get rid of that stuff, learning to cut out the unnecessary jargon and replace it with plain language alternatives is a priority.
Do you mean something like hypertension versus blood pressure?
Exactly. Yep. And that has a long way to go. We have a lot of work that needs to be done to figure out how to actually do that. How to train professionals to do that, and then how to help organizations and systems support those individuals to use those plain language practices. Another key practice would be reducing what we'll call information overload. So I can certainly relate to the idea of coming into a healthcare environment as a patient and getting more information than I could handle at that moment, particularly if you're distracted by pain, or you're not feeling well, or you're nervous, or you're scared about what's happening with you or a loved one. In those environments, right, when there's too much information coming, it makes it hard to remember any of it, or hard to make sense of it, or feel confident in your ability to use that information. And so learning how to reduce information overload is a second kind of concrete one that individuals and organizations and systems can focus in on. The other examples would be things we're maybe familiar with, like things like using teach-back routinely.
Confirming understanding,
or maybe even confirming that healthcare professional has been a clear communicator.
And I know about that, and I teach about it too, instead of saying to the person we're communicating to, do you understand? Where the only answer can be, no, get me out of here. It is, I want to see if I explain this clearly, and then have them do it in their own words. So thank you, Cliff. We will have a link to these clear communication strategies of universal precautions. That's wonderful. Also to your article, really making clear what the problems are. To kind of look at this within context. You and I have been doing this for a long time. You graciously acknowledge that this will be the 25th year of Health Literacy Month. So we, as individuals, organizations, researchers, practitioners, we've come to this level and we've accomplished something. Where do you see it going in years ahead?
I'm very hopeful. I see that these last 20 years there's been a lot of joy in the work. There's been a lot of work to do. And I see that there's been a lot of progress made.
Okay, good.
At times it feels, painfully slow, and it feels upsettingly difficult. But really, when we step back and look at how hard it is to change something as big as the U.S. healthcare system, there's a lot to be proud of that you and everyone else working in this field have contributed to these last 2 decades. And I think that is accelerating. I see it around me. I see awareness much higher now than it was 10 years ago. I see skill levels increasing. I see attention from leadership. So I'm real hopeful that we'll see an acceleration of progress, and that the next 20 years are going to really bring some, I think, remarkable change.
Thank you. I really love that. You bring joy, you see change, you bring hope. Cliff, thank you for being a leader in this, for helping us kind of look at some of the hard spots and also look at some of the solutions. And again, my gratefulness for you for being a guest on Health Literacy Out Loud.
Helen, thank you so much for having me. This has been a delight.
As we just heard from Cliff Coleman, it's important to look at the equity, the accessibility of how we communicate health information. But doing so is not always so easy. For help clearly communicating your health message, please take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. You can get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about health literacy out loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.